should discuss. If you're getting your associate's degree in social work, I would encourage you to listen to your SWU 171 class in social work to add to your historical understanding of how people understand mental health, child welfare, yes, child welfare, and all of those kinds of things. If you're going into public health, I would encourage you to listen to your public health classes about how governments have responded, all of those to mental health and public issues. What I'm giving is a very simplified version of the history of mental health and the history of why people explore abnormality. And so I hope you all listened to the recorded lecture from last Wednesday, because I'm just going to go back to it really quick. I'm going to bring up our PowerPoint, and I just want to point out a few things just in case you didn't do the recorded lecture. And so I'm going to go back. All right. There's two things that I just want to focus on just in case you guys didn't do the recorded lesson from last Wednesday, is how Western psychology and mental health and those defined mental illness. Okay, so again, like that lecture that I hope you listened to, the right white panel gives you the definition from the DSM-5, which is the Diagnostics and Statistical Manual of the American Psychiatric Association, which if you go to be a licensed mental health professional, you will use that in at least our Western medical model version of things that you will use to go give a diagnostic code to justify your therapy and treatment that you're going to give someone. Okay. And it's connected what's called the ICD-9, which is the international code thing. And so anything in the DSM is connected with a code internationally. And so either way, on a insurance level, this is the manual you would use to make it so you get paid for treating someone. And I want to focus on that importance because the demands on Native American nations to use it have become more and more. And they become more and more stringent. So if you were to do a degree in behavioral health, even within Native American services or within specific Native American nations, they would say you need to use this to diagnose and treat if you want to get paid for it. Okay, so it's an important thing. And so just to emphasize, because I gave a full lecture on this and I recorded it and I give it to you, I just want to focus on the difference between mental health and psychological disorders. In order to have a psychological disorder, according to this model, you have to have a cluster of abnormal behaviors. And in that lecture, I went through and I discussed we all will experience abnormal behaviors. We will all experience sadness, hallucinations, irregular behaviors, elation, aggression, delusions, self-harm, self-indulgence, anxiousness, scared, violence. We will all experience these behaviors, but to make them a mental health crisis for professional um, um, intervention, they need to cluster together. So I always use depression because it's a common cold of mental disorders. So I'll use depression. So someone who is experiencing sadness, depressed mood, thoughts of harm, irregular sleep, delusions, negative thoughts, self-harm, worried. Those are all a cluster of abnormal behaviors that define depression. Okay. And so this is what we look for when we're doing the difference. Does someone have a mental health issue or does someone have a mental disorder issue? Is the behavior, these abnormal behaviors have to cluster together. They have to exist, and we'll go into this. They have to exist in two major areas. And I'm going to kind of go down so we're looking at the gray panel on the left side, okay? Is one, they need to be persistent over time. And not only persistent over time, if you find yourself with those clusters of depressive behaviors at work, but not at home, you don't have a mental illness of depression. There's something with your work that needs to be resolved. Okay, so persistent over time is about it being deviant. It has to persist over different situations. The lecture that I'm going to have you listen to on ADHD and autism with children, if a child does not have autistic symptoms or ADHD symptoms in the home, church, grandma's house, uncle and aunt's house, but they only have it when they're at school, they don't have autism, they don't have ADHD. It's the situation that is causing their symptoms. And it's the situation that needs to be taken care of. But if they're doing those symptoms that in the lecture you'll listen to, it's at home, it's at school, it's at church, it's at grandma and grandpa's house, it's at this house, then they have a disorder. And that's a deviant part of it. Obviously, distress is a person has to recognize that it's not normal for them to experience these things because they might be at a birthday party. I'm going to bring up the depression example because I've suffered from depression. They may be at a birthday party at one of the most favorite grandchild they had, or in my case, my favorite child's birthday, or in my case, my wife's birthday. But if I was there and I experienced sadness, low motivation, low all that, low everything, and I could not engage, that is deviant and distressful to me. And because that's not normal to be in a happy place and experience this deep mood, hatefulness. When everyone around you is happy and they're joyful, that's what we call distressful. When you recognize, hey, I'm at a wedding, I'm at a birthday, I'm at a graduation, but I feel like, please plug your kids' ears, I feel like shit. And I feel miserable. The most important thing for a mental disorder, just to get on this train from the video that I assigned last Wednesday, is it has to be maladaptive. Okay, and so I'm going to bring up some cultural examples to explain the maladaptive part. The maladaptive part is that it makes it so that you can't engage in work, You can't engage in school. You can't eat right. You can't sleep right. You can't do any of those things. But this is why the maladaptive part is such an important component. All right. So there's what we call the Beck depression inventory. The Beck depression inventory is a standardized tool to see in Western culture if someone has clinical depression. And it's a very good tool. If it's used here, it's used in Europe and in those places. It's a wonderful tool. And if you're going to even work in Native American country, I would encourage you to use that tool because of the westernization and the colonization. And those individuals need help too, even despite colonization and westernization. But there are some countries in the Mediterranean, off the coast of Italy, off the coast of Canada in the Pacific and whatnot, that if you went and gave the Beck depression inventory to them, you would think that every person that lives there needs treatment for depression because every measure on the Beck depression inventory, they would say, yes, I feel miserable. Yes, I feel not miserable. I feel this way. I feel this way on the negative ends of that scale. Yet, they're some of the most functional cultures that we know of. The one off the coast of, they live on an island off of Italy. And if any you or I would have went there, I think you would go, this is the most depressing place on earth. Those people are the most resilient. They live longer, they have longer. Yes, they have this very depressed aspect to them, but their culture, they live longer than Western people who think that they have to have a happy view of everything. And so, anyways, I'm going to go back to the maladaptive part. It has to be maladaptive to the person and to their culture. It has to interrupt what they're going through and what they have. And so, okay, all right. And then in that video lecture, I hope you read or you listened or you read in the textbook about the difference between mental health and mental illness. And then I hope the other part that you really listen to is the role of trauma on both physical health and mental health. Those are all important components as we look at these different disorders. Okay. So I hope you go back, you listen to them. But what we're going to do today is talk about the just again, just a short, brief aspect of historical views of abnormal behavior. And one of the things that I want to express in this lecture is there are very similar things that we see across cultures that define abnormality. But I'm going to stop right here and just put in the chat really quick. If you listen to last week's lecture or my summary of here of what we did right here, does everyone understand where we're at about the difference between abnormal, mental illness, and mental health? Put yes or no in the chat. Thank you, Kobe. All right. Thank you, Anthony. Thank you, Loraya. All right. All right. Thank you, gang. Thank you, Alicia. All right. All right. So one thing that we do know across cultures is whether the Americas, the Europeans, the African, the Asian nation, there is something that is called moral corruption theory, that people go into abnormal behaviors because they lack the moral fortitude in some people, right? And so I'm going to bring this example up um, in this situation is that there was at one point in Western philosophy and Western ideas, and this is where you get the term tough skin. I hope everyone has heard that term about being tough skin. Nothing gets to you, nothing gets in you. Because at one point on this moral corruption idea, is it was believed that there were certain people who were more porous in their skin, physically and mentally, that because they were so porous in their skin, it allowed evil spirits to come into their skin and possess them to make them more manic, depressive, schizophrenic, morally disengaged, because their skin was so porous, it would allow evil spirits in. And that's where the idea of tough-skinned people comes from. Because if you're tough-skinned, then no one will let them in, right? And so this moral corruption theory, I'm going to say, existed both here in both here in the Americas, and and before America became colonized, it existed in the Europeans, the African nations, and the Asian nations. That people who have mental illness are morally corrupt. And so after the thousands of years of that happening, that is why mental illness is, even today, is shamed. Because your skin, again, I'm just going to take this back to original idea. You have a mental illness because you have such weak skin. You're so weak that evilness could enter your body and take you over. On an unconscious level, that's the stigma of mental illness and mental health. And I want everyone to realize this at this point. It's not a colonization thing. It's not a, it's a human thing to think that people have mental illness because they don't have the moral fortitude of everyone else. One of the examples of this was trephining. So trephining pre-colonization, pre-European, was seen across cultures. So on this left-hand panel, you will see an image of Aztecs trephining someone's brain. On the right side image, you can see the European version of trephining. What was trephining originally meant to be? Trephining in its original form was meant to be that if you drill a hole in the top of someone's head, which is the peak of anyone else, that would allow the release of the awful demon from that person and relieve them of their manic, depressive, or schizophrenic state. All right. And this evidence of trafficking can be found both here in the Americas and in the European nations. And so, did trafficking work? And this is where we have to go to only observation. Observation being what you observe as a clinician, observing that patient's response. Because in these early crude phases of trephining, what usually happened is that within the first few hours, the brain became diseased. Bacteria grew. Greenness grew, which is bacteria. And there was no antibiotics back then. But when those bacterias and everything entered the brain, the person was no longer depressed. The woman in this case, was no longer manic and everything, because the disease that was occurring in their brain, the affection, they couldn't respond to anything because they were dying of an infection. But from an observational perspective, they were perfectly treated. They no longer had the depressive or manic symptoms. And if they died, that meant that the devil left their body, the demon left their body. And now that they've died, their soul has gone back to Christ and the Lord. In the case of here in America, they've gone back to the different deities that they believed in, and they were saved. They were no longer captive by their mental illness or their mental health issue. All right. So now because guys, I did this with Sigmund Freud, we always have to fast forward. Does trephining have a good place in society? Yes, it did on the battlefield. Because through Vietnam, medics on the battlefield entered into trephining. Because what they realized, the earliest cases here in the United States were the Civil War. Okay, but I think it goes long before then in history. But I'm just bringing up here in the United States, we realized trephining was a good treatment for traumatic brain disorders. Because when someone has an insult to their brain region, so they're hit in the head and everything else, it's not usually the injury that kills them. It's because their brain swells and it squishes them inside of their skull. And so, at least here in the United States, since 1776, we're going to go into the Civil War and clear up to the Vietnam War. It was realized that drilling that hole was good because it allowed the brain to swell out of their skull. It didn't squish it in their skull. And so it saved a lot of individuals' life. Now, I will bring up modern treatment. In today's, they don't usually do trephining. They do anti-inflammatory medications. They pack their head in ice. They do everything to bring down the inflammation so that the brain doesn't squish itself inside the skull. So since about the Iraq War, the treatment has been evolved. But again, I just want to bring up this point that what seems awful evil as a form of mental health treatment at one point does have some saying in modern treatment, okay, especially with traumatic brain injury. All right, so let me bring up another example. So I've been talking about corruption theory, which is a moral theory. There was and there is again here in indigenous Native American land, there's more life-based theories. There's more natural-based theories. And so one of the theories that I want to bring up here is the Greek humor theory. Okay, so this is where I get to be a little bit funny. When you say someone is very humorous, you're saying their pee is white. When you say someone is being not humorous, you're saying their pee is very dark and yellow. Because the term humor comes from the Greek term humerus, which means body fluids. So when you say someone is in a good humor or a bad humor, you're talking about their body fluids from a linguistic perspective. And so I want to bring up this theory for two reasons. I want to bring up this theory for two reasons. Is that one of the first early treatments on a naturalistic, not a not a traditional mode of thinking, is that you bloodlet them. And so someone comes into you with hysteria, delusions, depression, and what you do is you put them on a table and you stick this needle up their spine and you bleed them out. This is called bloodletting. And what you're doing is letting out all of the blood so they're not depressed, hysterical, or delusional. All right? Because of this humorous theory that you need to let all of those bad fluids out of the individual, and that will be healing for that person. All right. So there's one thing before I leave the Greek humor theory and I get into the psychological aspects of this, is have we gone from people looking at whether your poop is black, white, yellow, or green, or whether your pee is yellow, white, or whatever, or anything else? No, we have not. Because when you go to your doctor and you say, I have these symptoms, the doctor's going to take some of your blood, your urine, your bile, and they're going to run it through a machine that will spin it around and around and around, and it will come up with these numbers that tells you about your health based upon your body fluids. It's called centrifuge. So this is the reason I like to bring this up. If you guys think this Greek humor theory has left Western medicine, it has not. I hope that we've gone more statistically and scientifically advanced in it. But when you go to the doctor, they're going to take your blood, they're going to put it in a machine, and they're going to look at some numbers, and they're going to say, based on your body fluid, this is what you have. All right. That's one instance where something that seems ridiculous is still with us today. On the other end, there's this thing called cathartic release, because I mentioned bloodletting. Bloodletting was where people would drain blood out of you to release all of those awful things out of your body and have them not exist. In the 1800s with Western philosophy and everything, they come up with this idea of what's called cathartic release, where where it's kind of this bottle up theory that the reason why people have anger issues and manic issues and everything else is because it's like a pop bottle that all of these things bubble up to the point that they just explode the lid and everything is released. So, based on the body fluid idea, people came up with what is known as cathartic release, where you go to a therapist or a counselor or anyone else and you tell them everything, let all of your emotions out, and then you'll be okay. All right. Is that fact or fiction? Here's what we know from science. Um, on the anger part, the bottle pressure theory doesn't work scientifically because what we find in anger management programs where people go in and they release all of their anger, who they're angry against, all of this, it makes them more angry. It makes them more aggressive. Why? Because they're remembering why they're so pissed off, angry. Sorry, I used the wrong term. I'm sorry, guys. This issue gets to me because I know so many domestic abusers who were assigned to anger management, but then they remembered why they were so angry and it increased their abuse towards their spouse. Anyways, so with anger, does this cathartic release, this blood letting work? No, it does not work. All right. But let's talk about other emotional states, depression, um, anxiety, PTSD, those types of treatments. So if I were to ask the class, um, how many times does a person go to treatment before they stop going to treatment? Some of you are in the field. I'm interested in your responses. If you can put it in the chat. How many people actually return to treatment after the first or second um, um, treatment? I'm curious, what percentage do you guys think? Come on, guys. What percentage do you guys think continue with treatment after the first or second session of treatment? There's no right or wrong answer. Thank you, Chloe. 60%. 40%. Thank you, Anthony. Kevin, 50%. Thank you. No right or wrong answers. Lorraine, thank you. 70%. Tia, 30%. Summer, 42%. Samina, 55%. All right. So let me give the statistical answer. 10 to 17% after the first or second treatment will return to do continued treatment. 10 to 17%. All right. And please, guys, I appreciate your answers. and I want you in this field now with those optimistic numbers. You belong here. If you need help uh, figuring out how you can be in this field, email me and let's talk. Let's talk. But only about 10 to 17% actually return to treatment after the first or second treatment modality. Overall, why? And that's the question, right? Why is it there's only this certain percentage of people who continue with treatment? And this comes to the cathartic release. And for those in the addiction studies certificate, you'll learn this in group techniques. Hopefully here soon at TOCC, we'll have a new course called Introduction to Counseling, which if you're interested, you can take so that you understand these things. Why do 10 to 17% of people return only return after the first or second treatment? And the answer is this. When we have gone back, we have wanted to know why. Is it us as the therapist? Are we crap? Did you not match with the therapist? Did you not agree with the treatment? Did you not do this? But so let's talk about the percentage that responded to the response. So yes, for 20% of people, they're like, I think the treatment that the therapist was bogus. I didn't feel connected with the therapist. I didn't do that. But let's talk about 80% of the respondents. 80% of the respondents said, you know what? This is the reason I didn't return after the first or second treatment. They said in this summary, it was the first time that anyone said to them, you can tell me anything you want to tell me. I'm not here to judge. I'm not here to do anything. And yes, they gave the state and federal mandates, child abuse, those kind of, other than, child abuse and vulnerable adults. Beyond that, anything you tell me is between you and me. I'm here to listen to you, not judge or respond. Right now, I'm here to listen to you. And for that 80+% of people who didn't have depressive symptoms, neurotic symptoms, delusional symptoms after that one or two sessions, is because it was the first time in their life they were told, you can tell me anything you want. Now, I'm not going to judge you. I'm going to listen. And that's where we're at. And then we'll go from there. And they felt such relief after doing that, they didn't need to go back because they finally had someone that said, cathartically release to me what you've gone through. I'm not going to judge you. I'm not going to say anything. I'm here to listen. Okay, so in this cathartic release thing, and this comes with from the Greek humor area, does it work with aggression and anger? No. Does it work with anxiety, depression, delusions, neuroticism? Yes. Because for many people, that'll be the only time in their life that they can express anything they want in their world. And someone will just be there going, oh, I'm listening. I understand. Is this what I'm hearing from you? Is this what you're stating to me? Please tell me, without the family, friends, and all of those judgments. So cathartic release works in certain situations, yes, in others, no. If it's dealing with aggression, no. If it's dealing with depression, anxiety, or neuroticism, yes. And so that's where I want to bring that up. Okay. And again, I will just bring back to the humor theory. We still think that your body fluids tell us something about your body. And so when you go to the doctor, they'll take your blood, they'll take your urine, they'll take your bio for whatever thing you report to them. And so this theory has not left us either. I just hope it's more refined. All right. So let's go on to the next one that I really want to return to, which is the Western example of moral corruption theory, which is witch hunts, right? So 15th, 16th, 17th, and actually well in the early parts and mid parts of the 18th century, witch hunts were very, I don't know how to explain this, um, popular in Western society. Is that? Yeah. I'm asking others for, it's popular to say that if I don't have a good yield in my farm, if I'm not successful, if I'm not this, I'm not that, I'm going to blame someone else and say they are the reason that I have my misfortune. And that is the basis for the witch hunts. So, but the thing that I want to focus on the witch hunts is one, the stigma, but also the idea of professional eyewitnesses. And this is a very important part to finish this discussion on abnormal psychologists, mental health, and mental illness. So, part one, blaming others for my misfortune. It is because of the homeless. It's because of the addicts. It's because of the mentally ill in my community that I can't pay my bills, take care of myself. I'm always having to look out for them. I always have to lock my door. So I have to do extra money for security and everything else because they are the problem. Someone else is the problem to my issues. And that was the basis of the witch hunts, is that at the time, especially when we started with the witch hunts, there was a lot of plague going on here in the United States. There were the inability for European Westerners not to survive here. Um, the lands were barren because it wasn't because of the natives at that point. It was because someone was doing something to make it so I was not successful. All right. The basis of the witch hunts. And of course, the basis of the witch hunts are going to be targeted towards two, two or three populations. One is going to be targeted towards women who were not subservient to men, did not obey their willings or their basis. It's going to be targeted towards the elderly because, after all, why are they living so long? It must be because they're tormenting my land and everything else in this pact with the devil. And then the last part of it is elderly men, which was, and this is why I bring this up at the last part of this. Women and elderly women were the target of the witch hunts. And so I'm the men that were part of this We're at the last part. They were elderly. They were trying to seek their life and existence. So they made this pact with the devil in order to make it so they could live longer. All right. So I'm setting this up. Male dominated world. We have science coming up. It's a scientific revolution. We have everything coming up, but there's people who are going through things that I would liken to what we went through the pandemic. And we had public officials saying the pandemic is a hoax. Um, the only way we got things passed to help people through the pandemic is because the officials who were in charge were forced to give help and all of those things. And so and again, the only reason I bring up the pandemic is we still are upheld to this idea that certain people are morally corrupt, they deserve to burn, they deserve to die, and all of us who are left are morally fortitude. We are strong, we are healthy. So let all of those people who get disease die and let all of us live, which is from a um, perspective on um, immunology. It's people who are exposed to something that become more resilient to it. It's those who are not exposed to toxins who are less resilient to it. So it's anti to anything we found in modern science. I just want to bring that fact up. Okay, so, but with moral corruption theory and the witch hunts, what do we have? And this is an important aspect that I want you all to know as we continue these conversations into childhood disorders, adult disorders, and everything else. And this is the most important part of this class that your professor wants to express. Is what the witch hunts did do in Western society is they did develop the idea of the expert witness, the person who has the knowledge about witchery, who did some pseudo-scientific and experiments and tests on the individual, and then they're entering into the courtroom and saying, based on my expertise and the tests I did, this is the person is a witch or not a witch. And this is an important turning point in Western or even worldly legal systems to the idea that we shouldn't listen to the experiences, we should listen to the experts and what the experts state about what is this and what is not. Okay, so I just want to rehearse though, because I think it's important for the witch trials to rehearse some of the scientific quote unquote that they put someone who was accused of witchery through. And this is given to the level of expertise. There was the float test. So women were bound, mostly women, and they were put on boards and they were put on this, and then women held them, and then men held them. Because those who are spiritual should go towards God, they should float. If they are towards the devil, they should sink. And so, those who, but this is the other part of quote unquote expertise. If they floated, it's because the devil was helping them manipulate the situation to show that they weren't witches. So in the float test, whether you floated or you drowned, it didn't matter. You were going to be evaluated on that expertise. The second test, another test that was often done, was the tear test. The tear test was that you told an individual about Jesus's execution. And I'm going to be honest with you, you guys. I'm not totally Christian. I have a lot of doubts about those things and whatnot. I have a lot about doubts about religion and everything. I've read the Quran, I've read the Bible, I've read all of these treatises on religion, and your professor is like, there needs to be more than these fairy tales. But one thing that always chokes me up is the sacrifice and the killing of Jesus Christ. It will choke me up every single time. It will make me swell up thinking that there is a person who would sacrifice himself, blah, blah, blah. It hits me in a very emotional way. The idea is if on the tear test, if someone does not tear up to the story, they must be a witch. And this is what convicted many elderly women of witchery, because as you age, your tear ducts actually dry out. Where, yes, if it's severe enough, that by a certain age, even though you could feel something emotionally and you can do and you want to cry, you won't produce tears because biologically you're at the age where the tear ducts aren't working the way they did at a younger age. So many women in their elder ages were convicted of being a witch because they weren't able to cry. The other one I have always thought to be a male issue. Um, because this profession was only done by men. They were usually young men, and this procedure was usually only done on younger women. And it's called the witch pitchery. It's where a male would take a female into a room and he would pitch all of her hairs out of her body until she was completely hairless. And then he would go and find the mark of a devil, whether it be a mole, a birthmark, or anything else. He would suddenly say, aha, this mark, this is the mark of the devil. This is where he entered her. This is where she made a pact with him. But the interesting thing with there were certain percentages where community members were allowed to see the perkers things, but for 90% greater for those, the community members were not allowed in the room. They weren't allowed anywhere. And he went and picked all of her hairs out of her body to find the mark of the devil. All right. So those are three tests that at the time where science and religion were trying to make a a combination. So you had secular churches, secular places listening to these trials, and then you had church trial people listening to these trials. But this is where the idea of the expert witness comes from. All right. And this is an important point to make about our science of abnormal psychology right now. Is they started witch perkers, float people, all of those individuals, the tear test, they would come and they would observe the person. But the interesting part of this is, and this is still today. So let me bring this up to modern time. You could have two people who have a Harvard degree in clinical psychology. So they went through the same treatment, the same education, the same training, the same philosophy of what develops mental illness, but dependent upon the people they are employed to, they will come up with two completely different results. And this is where I want to caution everybody about where we are with the development of mental illness. You go to your doctors, you go to doctor one, you go to doctor two, and you have an AC1 count above 7, and you go do the blood sugar result, and it shows that you're diabetic, both doctors will diagnose you with diabetes. But in mental illness, dependent upon the goal that is meant to be achieved for that individual, that professional will give you a diagnosis that is congruent with your experience, what you're going through, what you need to hear, what you need to feel, what the legal system, if this is the case, what the legal system needs to hear, what you are hiring them to prove. You won't find that in physical illness. You won't find that when someone is diagnosed with cancer or diabetes or anything else. You won't find people having to go to a court with two different professionals, with two both having the same education, but having two completely different diagnoses. And this comes from the witch hunts of the 15th, 16th, 17th, and 18th century in Western society, and the idea of the quote unquote expert witness. And so that's the second thing that I wanted to bring up with Western psychology. What time are we getting to? All right, gang, we are out of time. I just realized that. I apologize. I know we're supposed to be able to go to 6:30, but I will finish with the history of abnormality Monday when we return. But I will post also some lectures for this coming Wednesday, so you guys don't have to come here if you have family obligations. If you don't, just enjoy the time. But this coming Monday, when we return, I will finish this historical aspect because there are some areas we need to finish and we need to get through. So we'll finish those up.